Hey there. Welcome back to This Week in Pharmacy. I am your host, Todd Urey, founder of the Pharmacy Podcast Network. How was your holiday? I tell you what, I had one of the most relaxing holidays with my family that I can remember in a long time. My wife and I always get stressed out getting ready for holidays, having people over, but for some reason this year we were chill and it was great. And I am ready to be back for the new year. This is exciting. 2024 is going to be a monumental year, a pivotal year in the profession of pharmacy for multiple reasons. And I can't wait to talk to you and can't wait to share with you what we're doing to kick off the new year and what we're going to be doing in support of you, the pharmacists, the pharmacy technicians. We want you to reach out to more of us and collaborate with us and let us know what we're missing on our shows this week in pharmacy. And we have a big announcements. We have some things to share with you regarding conference season. We have the Pharmacy 50 to talk about, which is going to be wonderful. We have a wonderful interview with Dr. Jimmy Pruitt coming up. But first, let's get into some news. I tell you what, the whole landscape of our profession, as I've said, is changing. The role of the pharmacist is expanding, and organizations are now reacting to some of the innovation and disruption that has been out for more than 3 years, if not longer. And one of those phenomena, for those people listening, not watching on YouTube or watching where you have video. If you're just listening to the podcast version, I brought up an article that says new Walgreens CEO signals pharmacy giant will shift to drug pricing models, to new drug pricing models. And what this is referencing is a cost plus model. Now, that's not a new model to the profession of pharmacy. We've had privately owned pharmacies launch their own cost plus drugs. Right here in Pittsburgh, Pennsylvania, Dr. Kyle McCormick is running a cost plus cash driven only cash pharmacy. And it's wonderful. And he loves the freedom. The big giants now are looking at and putting a lot of investment and time in figuring out how do they go cost plus and how do they expand services that are internal to the organization and not attached to a pharmacy benefit manager, and really teaching the public that there's more control in your health when in fact you're not worried about anything being canceled or prior authorizations from a PBM. Very interesting article. This came out from fiercehealthcare.com. Once again, new Walgreens CEO signals pharmacy giant will shift to new drug pricing models, and the trickle-down economic effect of that will be significant. So keep your eye on that. Lilly pharma manufacturer, Lilly launches end-to-end digital health experience through something they're calling Lilly Direct. Pharmacy Podcast Network had a special project that we did with Lilly back in 2018. One of the first evidence-based podcast episodes and series that we put together through them and with them. Fascinating organization and investing a ton into digital health and how digital health tools are going to be tied into ongoing treatment modalities and treatment care. The pharmacist is in the middle of all this. That's why I'm bringing up this article, this investor release from Lilly.com in their news section. I want you to look this up. Lilly launches end-to-end digital health experience through Lilly Direct. How will you, as a pharmacist, leverage your knowledge and understanding of where digital health tools fit and where it can help a patient looking for more of those services? We have a lot to unpack in that realm. We do a podcast periodically around AI and technology called Digital Therapeutics, and we're looking for more discussion around that. If you're listening to the podcast right now and you have an interest in the expansion of pharmacist services and pharmacist consultation with technology as part of that, as that theme, please reach out to us. We would love to have you become part of our programming and really vet out, where are you seeing the most success with which tools? Is it telehealth? Is it messaging? Is it AI and text, like our friends at Pharmasol? What is the technology that you're gravitating towards, which may be part of a treatment program around hypertension or diabetes or something? But nonetheless, look this up. Hey, let's talk about conferences for 2024. We are already booked. I can't believe we are booked up for the entire first quarter. The conferences that we'll be attending, it's going to kick off with one down in Florida. This is one of the first conferences this year that we're going to that is outside of the pharmacy industry, and that is PodFest 2024. It's their 10th anniversary. And I have an interest, and we have an interest in becoming a better audio publication. And PodFest is going to bring us a lot of business to business interactions with people who have podcasted and have reached out and have a blending of B2B and B2C, business to consumer. This is important to us as a communications channel. We are reaching out to more pharmacists to start developing content for our consumer. So it comes from the right source, which is the medication expert, you, the pharmacist. So we're going to be in Orlando at PodFest, and I will be speaking at the segment, which is the first day of the conference, called Healthcare Amplified. Once again, that's Healthcare Amplified. This is a bunch of healthcare professionals who are also podcasters, who are also content developers, coming together to collaborate to build better, once again, professional to professional, provider to provider podcasting content. And it's going to be a professional workshop. This is not for the layperson. This is not for someone that's outside of the healthcare industry. So I'm excited to be speaking with people who know more about different facets of healthcare for us to learn, and then to bring this back to the Pharmacy Podcast Network and look to you, our pharmacists and technicians, to actually start building more content together through the Healthcare Amplified event. So if you can be in Orlando on January 25th, please let me know. I'd love to connect with you in Orlando. All right, the Pennsylvania Pharmacists Association's annual meeting is coming up quickly, February 2nd through 4th at the Hilton Harrisburg. If you are a member of the PPA, if you are a Pennsylvania pharmacist, I encourage you to meet us up at the PPA's 2024 conference. And this is going to be, once again, at the Hilton in Harrisburg, middle of the state. Great location to all come together. Very excited about this and supporting the PPA. Next conference I want to talk about, because I want this to be the Super Bowl for our profession, and that is the APHA, the American Pharmacists Association 2024 annual meeting and exposition in Orlando, Florida on March 22nd. Pharmacy Podcast Network will once again be embedded in the APHA's booth, and we will be running Locked on Pharmacy, which is the leading podcast of the APHA, and we're so proud to be part of that. But this is a time to come together and further what we started 2 years ago, last year at APHA 2023. And that is to really focus on things happening for our retail and our chain pharmacies around workplace environment stresses and how we need improvements there. So you don't want to miss the APHA 2024. It's going to be a lot going on, a lot of staging that's been happening for years. Things are finally starting to move, and we're seeing major changes happening, as well as the acceptance of change on those organizations that control a lot of our industry. And it's time to loosen that up and bring more of our pharmacist voices to light. And that's what we want to do here. That's our mission here at Pharmacy Podcast Network. How has your year of podcasting been? What other podcasts do you think we should be fusing with? Are there ones that you enjoy, that you talk with? We have a collaboration with Fellows on Call, which is a wonderful podcast by oncologists, and they have collaborated with the Pharmacy Podcast Network several times, looking for pharmacists that they can rely on to bring great information to the discussion. So look up that podcast if you haven't already. Fellows on Call. and let them know that you're thinking about them and that you enjoy their show. Their stuff is amazing and it's fun to listen to. So I'm excited about our interview. We have so many different interviews coming up through This Week in Pharmacy, but we're kicking off our second season. This is the second season of This Week in Pharmacy, 2024, our first episode back. And we have a special guest, which is Jimmy Pruitt. He's a fellow podcaster. Dr. Pruitt is amazing. He just released a new book. I can't wait for you to listen. And here we are with our interview with Dr. Jimmy Pruitt. Hey, and on This Week in Pharmacy, if you don't recognize this guy, you got to know this guy. If you're in the pharmacy industry, Dr. Jimmy Pruitt, it is an absolute honor and pleasure to have the one and only Pharm So Hard podcaster, one of my favorite podcasts on This Week in Pharmacy. But welcome, Jimmy.
Thank you for having me on. And so kind words. And like I said before, this is long overdue. We've been just busy kind of creating these different worlds and super excited to come on and talk to you and your audience. And it's been a great time.
It has. You know what? First of all, right out of the gate, what has podcasting taught you? I started in 2009. I didn't know what I was doing. I used to have to dial an 800 number to get other people on the show because that's the way they did it on Blog Talk Radio back in 2009. So, I mean, I have grown so much personally based on what podcasting has done for me in number one, in teaching me. It has been the biggest teaching mechanism than almost anything, including my education. Other than, I think fatherhood and podcasting would have both taught me about myself. But talk to me about being a podcaster right out of the gate.
I think podcasting has really taught me a few things. I would say the first one that podcasting really has done for me is taught me patience. I never imagined that I would be editing an episode for 16 hours, my first episode, but that's exactly what happened. And it taught me to be patient. So in my life is now kind of went alongside with me from parenting. It went alongside with me with being a practitioner, being patient as you're trying to create something. And one of the biggest things that is that you have this dream of where you want it to end up, where you want this thing to really be. And it takes a lot longer than you imagine it when you're sitting there thinking about this. So I think the patience to allow myself to build the podcast, allow myself to be patient in practice, but it is really one of those things where you can't get it right the first time, and you just have to keep going and going and going till it gets to where it is. And I'm nowhere close, nowhere close to where I want to be. But I think I've embraced being patient now. And I think that was one of the biggest things. And the next thing I would say was networking. This is something you're the king at. Right. But just being able to reach out to different people, see different ideas. And I think at this point in my podcasting career is looking at other avenues that I didn't traditionally look at. Looking at the oncology, looking at the specialty pharmacies, looking at all the other the things, because we farm so hard in a variety of areas. Yep. And I just want to give people the same thing you're doing, giving people that chance, that voice to have people see their content and to be able to hear their expertise. So I would say patience and networking are the two biggest things that podcasting has taught me.
Jimmy, before we started recording, I said to you, you cannot deny, no one in healthcare can deny, more specifically, no one in pharmacy can deny that we are in a major transformation of what is pharmacy, what is the pharmacist, what is the purpose of the knowledge, the experience, the truth of what pharmacists could do for a patient in any case: weight management, surgery, neo-intense, natal, maternal, sexual health, artificial intelligence development. I mean, we could go on and on and on. We are in this, and you and I are the audio documenters of an entire profession in multiple blends and their styles. And that's why I'm so in love with how many ideas come through this network. And it's never about one person. It's about this blending. So talk to you of what the heck is happening in pharmacy right now. And I'm excited about it, by the way, because 2024 is going to be, I don't know what's the word. This is a shout out to my Jelani Stafford, running back for UConn University Huskies, future running back. That is, he's actually a defensive tackle, but he hates when I use words like lit. So I'm going to just say 2024 is going to be lit.
Oh man, pharmacy, that's a loaded question. Pharmacy and what pharmacy is going to look like is going to be transformative. I think that's the term I would use because I think we've seen it, but I say the word transformative for not my purpose, but for where the public and what other healthcare professionals are going to see pharmacists. And you've mentioned some of the key things, but we're getting to a point where legislation has been being passed in North Carolina to allow pharmacists to do more, particularly in the or contraceptive component, to be able to bill for certain things. I think that with the expansion of just the public view of pharmacists is going to be amazing. So, and then pharmacists now are starting to become more independent and start to display their skill sets in different locations. I'm pretty sure you've had tons of people on the podcast that can talk to you about pharmacogenomics, that can talk to you about weight loss, that can talk to you about all the things that the public has seen as being only for a physician. And don't get me wrong, they're fighting their own challenges right now. I work side by side with them every day. But again, as far as being able to have the pharmacist's role and expertise on forefront, that's where I believe we're going. AI is going to help with that. AI is going to be able to transform these things more quickly. And I think the personality of pharmacy is changing. If you go back 10, 20 years ago, the pharmacist was the person that sat in the basement in the hospitals and didn't want to talk too much unless that was the case. Now there's hundreds of pharmacist podcasts. There's tons of personalities coming out to allow for a different perspective of what pharmacy is. And we're talking all throughout inpatient, outpatient. I think about an emergency department. The things that when I talk to some of the founders like Frank Polishek and Brian Hayes and some of these people who got their early start in the 80s, 90s, and 2000s, what they were doing and pioneering was phenomenal. And it laid a foundation to what we can do today at the bedside. There's almost nothing that can happen at the bedside, from medication administration to making very quick decisions, running codes, all the things that we didn't think that pharmacists do is common practice now. So I believe that to wrap all this up, in every aspect of pharmacy, there's going to be a transformation in not what we see, but I think what the public, the payers, the third-party payers, and all the other practitioners are going to see. So I think it'll be very transformative the year 2024.
Absolutely. Acceleration. I see the national associations have been more collaborative than ever before. We see the National Community Pharmacists Association working much closer with the APHA. We see the state associations coming together. There have been on the West Coast as well as in our central states. There have been a collaborative of pharmacy states coming together, state associations, to do all of their national conferences in a unified, so that they're actually able to bring multiple people together and more minds together to really start driving the type of change that is sometimes specific to a state based on how they've accelerated provider status, versus some of the more innovation that's coming out of, as you said, taking artificial intelligence and being able to now attach it to treatment program guidelines and follow-ups to that treatment, and embed that in specialty pharmacy management systems and directories of information, and then being able to react to the texting of your client or your patient per se about how their treatment is going. What I just described to you, it's called PharmaSol, by the way. It was invented by a pharmacist, is being able to collaborate on a digital where people are on their freaking phones and texting all the time, and blending that with treatment follow-up, and how that's all directed. All of that information is going to be more directed to hitting the pharmacist's desk first, so that they can make notes and react and move forward, because most of the time those people are on some kind of medication, and then being able to pass all that data back to the physician's EHR. So Don't even get me started. Like 2024 is going to definitely be lit.
Absolutely. Again, it's going to be very exciting to see. And I'm just so excited for all the pharmacy creators. All move from content creation now to more of a business model and just product creation, which I think is going to be beneficial for everyone.
Yep. So let's talk about branding right out of the gate also. So because 2024, with being such a transformative year, the element of branding, what you do, who you are, and how you stand out is so important. So I'm talking to every pharmacist under, active in the United States, for example. I mean, we're a global publication, but I'm going to center this discussion about branding based on the United States. And so you are a long-term care pharmacist, you're a consultant pharmacist, you work with physicians, you're in pharmacogenomics, you're consulting in technology, you're MSL, retail chain, it doesn't matter. You have done an amazing job in branding yourself, Jimmy, and I want you to share, and we're showing, if you're listening to the podcast audio, you're just hearing Jimmy and I talk, but if you're watching on YouTube, we have this version. You can see the designed, very meticulous, very well done, branded, farm so hard. And Jimmy, why is that important in today's age for being
I
a farm?
think the biggest thing, and I've given a few presentations on this at the national level, is that when people in this digital world we live in, we have to accept that's who we are. One of the things you want to make sure is that if someone ever wants to look for you, you have something waiting for them. And I've tried my best with the brands that I work with, and I have a few different things that I work on, but I want every time someone types in Jimmy Pruitt, that something's waiting for them. And
Yeah.
I want to control that narrative of what it is that's waiting for them. So whether we're talking about the podcast, I want people to know that our podcast is going to be emergency medicine and pharmacy, a hospital pharmacy podcast. But I think within the first few seconds of you listening to my intro, you understand the type of podcast it's going to be. It's going to be a little bit more urban. You want to make sure you find a way to be slightly different. And I think that's the biggest thing that I try to do is be myself and to have the products that I build to be a representation of that. So I think anyone that's out there, you have to make sure that when people look for you, you like what they see accidentally. So no matter what it is, from a logo, from whatever you want to be known as, again, and Todd, you've done a phenomenal job of this, not just for yourself, but you've done branding for other people and kind of curated what they're doing. So I think
Absolutely.
that's something that's unique. So when people look for me, and that's what I post, and I do things just to make sure that when people are looking for a particular thing, or you're looking for me or curious about me, I really like what they're going to see when they get there.
Yep. I'm glad you said that. I always think of myself as the kind of like the sports agent of the pharmacist, and that is someone that is looking out for them from a network and business and industry and wide stance perspective. And when I started helping to create brands under the audio acceleration of what happened to podcasting, especially just in the last really 3 years, it's been explosive. 151, no, 154 million listeners to podcast in the United States. So we have a 335 million, you know, society of people, and half of them are listening to podcasts. So when I started thinking of that as a marketer myself, someone in business development and pharmacy technology, I brought all that to the table, 22 years of it. And I said, so how do I amplify the voice of the pharmacist and being able to teach the profession of what the profession is truly capable of? Because pharmacists just were so intense over the years of me knowing this, since it'll be my 20th year in pharmacy, and this coming up 2024. It's very special year for me. It's a transformative year even for me personally. And I see what's happening to pharmacists from they're rising, and they're not under the They're not being held back like they used to be anymore. But it started with themselves. It started with you and the way you thought about yourself and the way that what you believed you were capable of doing, because you were so meticulous in the data to make sure that nobody was dying from the drug interactions and what was happening to them. You're so intense in the data that through your 4, 6, and 8 years of school, your personalities were not about blowing yourself up. It wasn't about pushing your brand out there or being but today, 20 years later, Jimmy, my 20th year here, and I'm seeing pharmacists exploding. Like, look at the Pharmacy 50. It's our third annual Pharmacy 50 coming up. The 50 most influential people in our industry driving change. And you will not believe this list that's coming of these people that are just they all give me chills. Like, all of them have backstories and all of them have, and that is a time to capitalize on all of them and build brands so that the community and the public and our people know what the heck our pharmacists actually do and what they're capable of doing to change your life. And so 2024 is also about blowing up the pharmacist, in my opinion. I'm going to do it.
Like you've always done, but it's going to be just on another level. So it's going to be exciting to see. And it's one of those things where I think that we are starting to come around to it. Like, what are we doing? Is it okay to stand out? And I think this is even going to the bedside. So we're talking about, again, blowing the pharmacists up in the products that we're making. But even at the bedside, I remember being in certain codes where I'm like, hey, this is the medication we should use. I believe in it. Physician, do you think this is what we need? They're like, whoa, okay. Do you think this is the problem? I think this is the solution. And if you think that, you agree with that, let's do this. And having that certainty and having that certain about just being able to be very forthcoming and really just give it to the team. Hey, this is what I want to do. That changed the way they looked at myself, my colleagues, as being more of that partner in severe situations. And the thing I like to tell people that I work with, I said, I just want to be a good person in a bad time.
Oh, man.
When things are going rough, I want to be a good person in a bad time. And that's where I think from the bedside that started, but we're being able to see everyone take examples like that and show it to the world. So it's going to be a phenomenal time.
So talk to me for just a second about how emergency medicine and being a pharmacist in a hospital in an emergency setting, how has that evolved and changed, especially within the last, let's say, 3 to 5 years?
Oh man, it's been amazing, and I've spoken with Brian Hayes and Frank Polachek, people who's kind of been the pioneers of this, and one of the founders of ACCP. Again, what was an ED pharmacist. So I think as we look at that, particularly the last 5 years, what has happened is that it becomes more. People are more accustomed to having pharmacists there. So we go back to before 2010, we will say less than probably 10% of these major academic centers had ED pharmacists. So that number has drastically changed. We don't have any formal things yet, but I have on my list over 250 people, 50 sites that has given me data of what they're doing at the bedside. And it's phenomenal. So from when a patient leaves and they get a urine culture, a pharmacist is calling back on that, changing the medication, getting it sent out there. During times where we're doing procedural sedations, when people are using very high and potent medication, the pharmacist is drawing that up. And in a lot of cases, probably more than people think, administering these medications. So I think from what a pharmacist can do and being a practitioner in a sense has changed dramatically over the years, because again, we're just doing more at the bedside. And one of the things I tell people is that we take it from brain to vein. So we take what's ever in the provider and the nurse's brain, and then our responsibility is to transform that to the patient's vein in the most effective, the safest, the most cost efficient for our system. And we're a lot more involved in these areas over the last 5 to 10 years than we ever have. And the best part about it, people like Megan Rett and Lance Ray, people who are publishing this data, everyone is able to see that a pharmacist in your emergency department can save you millions of dollars.
Mm-hmm.
It can save you a ton of patients. But I think that the thing that people don't think about as much is that what ED pharmacists are doing, we're making the system of medication administration more efficient. we give the providers the best medication for the right patient, and we make sure we can do that consistently. And when times are more challenging, things like traumas, people's arms are getting, pulled off, and we have a lot of very graphic things happening. Your pharmacist is there to make sure that that emotion and that scene doesn't inhibit effective and, more importantly, safe medication administration. So I'm excited where we're going. One of the things that I'm working on right now is the creation and the putting together of the Society of Emergency Medicine Pharmacists. That's one of the biggest things that's going to be coming in 2024, and getting people to be able to see and advocate for emergency medicine pharmacists as a whole, not just here in the US, but also for my colleagues in Australia, also for my colleagues that are in Germany just starting up practices, and those that are in Saudi Arabia who are building all these places have emergency medicine pharmacists. But I think what we want to do is unify all of them, whether you're academic, whether you're community, whether you don't have those titles. That's what I think emergency medicine pharmacy is going to look like in the next few years. And I think over the last, again, 3 to 5 years, it's just been an abundance of increase in scope and enabled to better take care of our patients and help our teams.
All right. So there are about 305,000 active pharmacists in the country, in the United States. There are less than 500 board certified emergency medicine pharmacists in the country. That would tell me that that is a major, major, major opportunity for a pharmacist to differentiate themselves to their markets and be able to market themselves to a hospital system. If that's the career that if you want to become the best emergency medicine pharmacist in the nation, and you want to go after, a specific health system, and you want to market yourself, do you think it's necessary to start at that BPS level and get your board certification?
I think it's one of the things that we should look at. Again, I was a part of the first cohort that got BCEMP. I was involved in making board certification prep for that. One thing that I have to look at and say is that looking at it from the hiring manager side, looking at it from a residency director standpoint, looking at it from working side by side with some of my colleagues and saying, what's the thing that's going to help separate you?
Yeah.
And that's going to be a key.
Mark.
And I think studying for those exams, just the preparation for those exams, has made me a better pharmacist night and day. Because what happens is every emergency department have their thing. They have their certain patient population. They have all those things. And you start to forget the other component that you don't see as often. Some places are not stroke centers, so they don't get to see a lot of those. Certain places are not trauma centers, so they don't see those. So a lot of patients are pediatric, and we don't deal with those. The board certification helps bring all of those together to whether you take the exam, you pass the exam. So it makes you a better pharmacist. And what it does is it helps you stand out when we're looking at 50 people that have the same exact background. That may be an extra piece that puts you ahead. And honestly, when I look at it, is that it can't hurt you. That's the one thing it can't do. It can't hurt you. And there's an upside to how much it can benefit you. And I think that most people should get it. I think that most people should, again, allow themselves to go through that process of getting certified and maintaining that certificate, because it takes the continued education. It takes all those things. And realistically, at the end of the day, our patients benefit the most from us being board certified because of the information we have to learn and because of the continuing education that's required from us. So I think from a patient safety standpoint, I think it's one of the best things that we as emergency medicine pharmacists can do.
Jimmy, before we wrap up, please share with the listeners how they can best support you, because you have several things happening in 2024. Can you share what's coming up for you and give us some shout outs of how we can support you?
Absolutely. I'm most active on LinkedIn and Twitter. You can find me on Twitter at PharmD_NDED. That's the quickest way to engage with me. But as far as products and things that I love the creation process, you're part of this as well. I love that. The number one thing that I'm be working on this year is going to be our emergency medicine conference, Empower RX, the emergency medicine pharmacotherapy resuscitation. We're going into our third year. This is going to be special because we went from a virtual, we partnered with a society last year. And then based off the feedback, people really wanted to feel more immersed. People wanted to feel more personal. They wanted it to be very unique to emergency medicine pharmacists. So we created our own place. We have our conference April 26th and 27th in Charlotte at the Hilton's Embassy Suite. Again, you can find that at empowerrx/conference.com. I'll make sure that information is published somewhere. But if you just type in EmpowerRx Conference in Google, I'm pretty sure it's going to pop up because we talked about that branding there before. That's right. My big thing. That's my big thing. And my committee has been phenomenal with that. Louisa Sullivan, Judah Brown, all of those has been part of my committee, all my chairs and people who part of that has been phenomenal. That's number one for me. Number two is going to be the book. So we have recently launched, I think I have a copy here. The Code Blue Pharmacotherapy. That's going to be my first publication that I have on the in-depth guide to cardiac arrest medications. You can find that on Amazon. You can type in Jimmy Pruitt and it'll come up. You can type in Code Blue Pharmacotherapy. That comes up. That's my two big things. Of course, we're going to continue to be podcast brothers with Pharm So Hard. That's something that we can look at. But my big things right now can be Code Blue Pharmacotherapy. You can find it all throughout there. I spent quite a bit of time creating this because it was something that my residents wanted. They wanted to see my opinion. They wanted to see a collection of the data. This is something that I think that your nursing staff, your physicians, everyone can get a good hold of, because what it does is it takes you through some of the background, the things that some people could know, but then we start to collect and review a lot of the data. And that's the part where maybe you didn't read the studies all the way up until this year. There may be a few that you haven't seen before. So we looked at all the medications in there, and we looked at some different scenarios. So I really think that's a phenomenal book to have if you respond to codes, because it may be something that's going on that you don't agree with, but you don't have something immediately available to kind of tell you what the data is, what the recommendations are, or what the guidelines say. So Code Blue Pharmacotherapy was, again, a pleasure to write. And I'm hoping it can help not just pharmacists, but everyone that engages themselves with cardiac arrest and who just deal with medications in general. So those are my two big things this year: the Empower RX conference, and then my book, the first one I've wrote, Code Blue Pharmacotherapy. So super excited about those two.
It's incredible. That's incredible. Code Blue Pharmacotherapy. It's actually on Amazon. We just showed you a picture of it. If you are listening, however, don't worry. If you're driving, walking, don't worry. We're going to have some show notes. In the show notes, we're going to have some links. We're going to have the link to the book. We're going to have the link to the association, to actually Jimmy and your podcast as well. Pharm So Hard. Jimmy, would you please send me a Pharm So Hard t-shirt so that I can rep it on some of our future This Week in Pharmacies?
I got you. I will get that sent over to you.
And I will send you a Pharmacy Podcast Network.
Got to, man. Got to send me some merch, because it's gonna be lit. I gotta be lit all 2024. So I gotta have that.
Oh, love it. All right. Well, thank you so much for being our guest on This Week in Pharmacy. If there's anything else that we can ever help promote for you in 2024, just let us know. But I'm so proud of what you've done and what you've grown. You got to keep going. And I think this is all about gas pedal down for the new year.
Absolutely. Just all go all the way through, and just we'll look back at in this time next year and to see what we can do and continue to build things for the pharmacy world.
Absolutely. All right. Thanks for listening to this week's This Week in Pharmacy, and we will talk to you soon. What a pioneer in believing in education, believing in what pharmacists are capable of doing. And, that's what I have been really committed to doing for years. If you are doing something in retail community pharmacy, in specialty pharmacy, in long-term care, in pediatrics, and it's something special that you've put your heart and soul in and you've built it out, it's a paper, it's a journal article, it's an idea. We want you as a leader in our pharmacy care sector of healthcare. We want you to talk about it. And that's why I'm excited to announce that the 50 most influential leaders in pharmacy, the awards, is happening on January 17th. If you'd like information on this awards program, please go to pharmacy50.us. Once again, that's pharmacy50.us. The Pharmacy 50, this is our third annual Pharmacy 50 celebration. We have a brand new list of people that have made the list. We have about right around 10 that came from previous years who have been recognized once again as a very influential person in our pharmacy industry. Both pharmacists and non-pharmacists have made the list. I'm so proud of how much attention we drove and where this is going to take us as building themes for other discussions to educate not only other people in healthcare, provider to provider, but also to help educate our consumers as to what in the world is pharmacy care. What's the evolution of our pharmacists, the role of our pharmacists in pharmacy care. Don't miss the awards. Once again, January 17th. It's going to be a party. It's going to be amazing. It's going to be, we're going to start around 12:30 Eastern time on the 17th, but 9:30 on Pacific time. And we're going to go over all of the Pharmacy 50 who were nominated and who were voted for. We had more votes than ever before. We had a 300% increase in votes from 2022, and 2023 was a hard year. It was a very hard year, but we're celebrating the pharmacists that really made a difference in 2023, and we want you to be a part of it. So if you're listening, once again, go to pharmacy50.us. Please share that link. Share that link to celebrate our industry and celebrate our profession, and watch us live on the 17th, which is Wednesday, not next Wednesday, but the Wednesday after that. Hey, listen, that's all we have for This Week in Pharmacy. If there's, once again, anything that we're not touching on that needs more attention, any specialty rare disease state, any process, any new technology that's coming out, or something that's not even in pharmacy that you'd like to actually talk about and be able to give back to our listeners listening right now. Thank you, listeners, for listening to This Week in Pharmacy. I'm your host, Todd Urey, founder of the Pharmacy Podcast Network. Hope you have a great week.